A pregnant patient asks you, "Doctor, when is my due date?" If you hesitate here, you're missing one of the most basic and most tested concepts in obstetrics. Let's make this simple and exam-proof. Naegele's formula is used to calculate the expected date of delivery, or EDD, based on the last menstrual period. It assumes a regular 28-day cycle with ovulation on day 14. Here's the formula. Take the first day of the last menstrual period. Add 7 days, add 9 months. That gives you an approximate EDD, which corresponds to 280 days or 40 weeks from the LMP. Let's do a quick example. If the LMP is March 18th, 2026, adding 7 days makes it 25. Adding 9 months makes it December. So the expected date of delivery will be on the 25th of December, 2026. Let's take another example. If the LMP is the 7th of October, 2026, adding 7 days makes it 14. Adding 9 months makes it July. So the expected date of delivery will be on 14th July 2026. But if you stop here, you'll lose marks, and worse, make clinical errors, because this formula assumes a perfect 28-day cycle. So you must correct it based on cycle length. If the cycle is shorter than 28 days, subtract the difference. For example, a 26-day cycle means subtract 2 days from the EDD. If the cycle is longer than 28 days, add the difference. For example, a 32-day cycle means add 4 days. So your final corrected EDD is rough EDD plus or minus the difference from a 28-day cycle. Now here's the high-yield exam trap. Naegele's formula is unreliable in several situations. Irregular menstrual cycles, unknown or unreliable LMP, recent use of oral contraceptive pills, lactating women, or when the uterine size does not correspond to the gestational age. In all these cases, do not depend on LMP. Ultrasound becomes the gold standard, and the most accurate parameter is the crown rump length measured in the first trimester. It gives the best estimate of gestational age and helps correct the EDD. One final clinical insight. EDD is not an exact date. It is an estimate. Only about 4 to 5% of women deliver exactly on that day. Most deliver within a range of 1 week before or after. So the real takeaway is this. Use Naegele's formula for quick estimation. Always adjust for cycle length. And rely on early ultrasound when precision matters. That's how you approach EDD, in exams and in real patients. This is the Why Medic. Subscribe for more high-yield topics.